make the tablets. We need to start our carcinogenicity program, and then the standard clinical things that you need for your NDA, so your QT interval study. You've got to have 2 large pivotal studies, other studies looking at special populations, and just the logistics of trying to do multiple studies in multiple locations. Oops. So what I'd say about drug development is it's not easy, but that I have really, really enjoyed it. It's the best job I've ever had. And I wouldn't change it. I'm quite happy to stay doing this for the rest of my life until I retire quite soon. Going back to what I said at the beginning, you've always got to be prepared to meet the unexpected. You don't know what your product's going to throw at you at any stage, and you've got to always be looking at the data and thinking about how best, to move your product forward. The local expertise where potential jobs are for you. Into the DEA we had study managers, but most of the work was contracted out to statisticians, medical specialists. Otago University was brilliant with their chemistry and their preclinical work. IRL, they have brilliant chemists there and analysts. Douglas from formulation, manufacturing, stability, figuring out what our impurities are and if they're going to be a problem. Then CCST in Christchurch, ESR in Wellington, and CTRU based here did our web-based database. Oops, wrong way. No career path again. I did B-Pharm at Otago. I just wanted to be a retail pharmacist. That was my plan. But no one would give me a job except Middlemore Hospital, so I went there. And from there, I worked for Roche New Zealand for a long time. Started off in clinical research, monitoring studies and doing submissions to the Ministry of Health. And then did a bit of marketing of hospital products. So I sort of had this side and this side. Then I went to Roche UK to set up what they call medical marketing. So being such a huge company, they had their clinical research people in buildings on one side of the road and their marketing people in buildings on the other side of the road, and no one ever crossed the road. So my job was to make them cross the road, which meant basically the phase 4 studies that were needed that were based on the research guys' experience and results, but that the marketing guys needed to sell the product. Then I came back to New Zealand and did studies, phase 2 studies that were requested by the FDA to finish off completing registration of products. And that was pretty good. I did a Masters in Management along the side. I actually did it in Healthcare Priorities of the People of Auckland, which I haven't used at all, but some of the management papers were really useful. And then doing what I've been doing, I just talked to you about for 4 years. So what I say is that there's lots of entry points into the industry. Just don't look at the little biotech companies, the little discovery development companies. Look at all the vendors who they use, because most of us are small and have to contract out most of our services. And then the usual things, self-starter, attention to detail, be good at planning, be good at dealing with people, and be good at managing conflict when you need to. That's it.